These are the signs that I had an anxiety disorder. I'm probably like 21, and up to this point I didn't know I had an anxiety disorder. My anxiety was so bad that I couldn't fall asleep until 3 or 4 a.m. What helped me before I started taking medication was welcome back to my channel. I hope you're doing well. Today's video, I'm going to be talking about my mental health. First of all, how did I know I had an anxiety disorder? Second of all, I'm going to explore how I dealt with it before going to professionals for help. And third, I'm going to talk about how I got professional help for my mental health and what was that like and how it's helped me. About 2 years ago, I was diagnosed with a anxiety and panic disorder. I went to Ryerson University and I went to the medical center there, and they gave me a mental health assessment and they ended up diagnosing me with a anxiety and panic disorder. And then later on, I got diagnosed with PMDD, which is premenstrual dysphoric disorder. But in today's video, I'm just going to be talking about my anxiety and panic disorder and my experience with that. Funny thing is, I've had this anxiety disorder since I was 7 years old, and I wasn't diagnosed with it until I was 20 years old. When I was a young kid, I didn't know about like mental health disorders. I don't think a lot of people did. And so for me, the anxiety I was experiencing all throughout my childhood, it seemed like normal to me. It didn't seem out of the blue. It didn't seem strange because it's just what I was used to feeling like. These are the signs that I had an anxiety disorder. First of all, I constantly pick my fingers. So I pick the skin off my fingers whenever I'm anxious, and either it's my fingers or my lips, but I am fidgeting a lot and I'm picking my skin when I'm anxious. And I've done that since I was 7 years old, and that's how anxiety shows up in me physically. And my head starts to feel a little disoriented. I feel a little off. I have a hard time concentrating on what's going on around me in my environment. So when I was at work and I was like experiencing anxiety, it was really hard for me to be in the present moment, and it was really hard for me to focus because I was so consumed inside of me with all of these feelings and thoughts that were going on. Also, another sign that I had really bad anxiety was I had trouble sleeping at night. There was a point in my life where my anxiety was so bad, and this was before I started medication. My anxiety was so bad that I couldn't fall asleep until 3 or 4 a.m. Once I started journaling and once I started to drink alcohol. Those two things helped me identify that I had really bad anxiety, because with alcohol I was experiencing different states of mind, right? And after I drank alcohol, I would have panic attacks and it would be scary. I wouldn't understand it. This led me to understand that, you know, there's a problem here. Something's not right. And through journaling, I was able to realize that I was experiencing these intense feelings every day. And so how I started to treat my anxiety disorder on my own was I actually started to work out more. Found my anxiety felt a lot better after a good workout of lifting weights. The second thing I started to do is, because I realized that my anxiety was so much worse when I drank alcohol, to the point where I had panic attacks because of alcohol, I realized that alcohol I just couldn't consume anymore. It was like a no-brainer. I had to cut out alcohol. And I started focusing on my sleep, because I noticed when I didn't get a good night's sleep, my anxiety was so much worse. And the fourth thing I started focusing on was drinking less coffee, because the more coffee I drank, the more anxious I felt. Those were just some ways that I was dealing with my anxiety disorder on my own without professional or medical treatment. After doing all of these things, my anxiety was still really bad. Thinking of taking medication was like a big no-no. I was like, no, I need to deal with this on my own. I can't rely on medication. I had all of these limiting beliefs around medication that made me very hesitant to even exploring it. So I started to do therapy alongside of implementing more exercise, canceling out alcohol and coffee, and sleeping better. I started to go to therapy. I thought, you know, if I go to therapy, I can figure this out and we can solve the problem. So I started going to therapy, and it did help a lot. It was like the first time that someone really validated my feelings and emotions, and I was able to realize where this anxiety stems from and what has created this intense anxiety in my life. Going to therapy and learning all of these things and learning how my childhood experiences have affected my mental health was so empowering, because I realized, you know, this isn't my fault. Understanding my mental health more gave me more power. And the more that I understood my mental health, and the more that I understood my emotions and my anxiety, the more empowered I was. So therapy was huge for me. I did group therapy first, and then I did individual therapy. I went to therapy, and that was helping a lot, but I was still experiencing really bad anxiety. My friend actually encouraged me to talk to a doctor about it. I'm probably like 21, and up to this point I didn't know I had an anxiety disorder. I just thought I had like normal anxiety, whatever that means. So I book an appointment to get a mental health assessment at the medical center at Ryerson, and the doctor asked me a bunch of questions, and she ended up diagnosing me with an anxiety and panic disorder. And then from there we moved into her doctor's office, the other office, and we talked about my options. We talked about different medications that she recommended. The doctor told me I should start changing my lifestyle first and seeing a therapist before I start exploring medication, and I think this is what a lot of doctors do. And when she told me that, I laughed and I was like, yeah, I have been doing that. I was like, I live such a healthy lifestyle, and I'm so reflective, and I'm so healthy with everything that I do. I'm very self-aware, and I'm very proactive about this, and I've tried everything. I've seen therapists. I'm currently seeing a therapist. And she was like, okay. She recommended Zoloft. It's also called sertraline. The first time she prescribed me with medication, she gave me a very low dose, and it worked well for me. I was doing really well. It helped me a lot. It wasn't smooth sailing right away, but after a while I noticed, like after a few months, I noticed a big difference. We eventually increased my dose because of my PMDD, and now here we are almost 2 years later of starting this medication. I'm still on it, and I actually just recently increased my dose again. That is how I'm dealing with my mental health. I see a therapist, and I take medication for my anxiety disorder, and I still implement all these things like living a healthy lifestyle. The only difference is I don't have to be so reliant on these things. Like now I can drink coffee without having a panic attack. Nothing at all, like no effect. Coffee is like a positive thing in my life now. Sleep, oh my goodness, I can fall asleep so much easier now. And even when I'm tired, I don't get anxious anymore. I now exercise whenever I want to. I don't rely on it to make me feel good mentally. I'm able to drink alcohol when I want to, and I don't have to completely cut it out of my life. And so I think that's what the difference is like the medication allows me to live life on my terms, and it allows me to live my life more enjoyably without worrying that I'm gonna get triggered and something's gonna give me a panic attack, or something's gonna make me so anxious that I just can't deal with it. Medication has made me feel like a normal human. I still experience anxiety, like that's why we increased my dose recently. Sometimes that has to do with like changes in your life, and it's an ongoing journey treating your mental health. It's not like you treat it once and it's over with. It's not like you take a shot and you're cured, right? It's an ongoing journey of treating your mental health, and what's helped me so much is honestly journaling. This helps me be self-aware of how I'm feeling and thinking, and through this self-awareness I'm able to identify when there's changes in my mental health. I'm able to identify whether my mental health is getting better or worse, and that is so needed when getting treatment for mental health, because the mental health professionals can't just tell you how you're feeling and give you a diagnosis. You have to be able to articulate yourself and tell them how you're feeling, and that's the tricky part. Mental health is really hard. It's It's hard to deal with at times, right? Other times you're like, oh, it's fine, I'm great, I'm doing good. Other times it's a shit show. What helped me before I started taking medication was I stopped fighting myself. I stopped fighting my anxiety. I stopped judging it. When I felt really anxious, I tended to make fun of myself and be really hard on myself. And I'd be like, why are you feeling so anxious? This is so silly. This doesn't make sense. And I would just totally like be upset that I was feeling anxiety. And I would judge myself. I would criticize myself. And I would just fight it. I didn't want to admit that I was feeling anxious. I didn't want to admit that my anxiety was as bad as it was. And what really helped me in those moments of experiencing anxiety was not fighting it, but rather accepting the fact that this is how I am and that I am experiencing anxiety in this moment, and that's okay. This simple mindset shift and this approach to my mental health has helped me so much. Like anytime I'm feeling something that I don't want to feel, instead of fighting it, I accept it. I accept that it's happening, and I be kind to myself when dealing with it. Face it, accept it, and be there for yourself in that moment when you're having a really hard time. It helps a ton. Second thing that's really helped me is detaching from it. So yes, I've been diagnosed with an anxiety and panic disorder, but that doesn't mean I wear a sign on me saying I have an anxiety and panic disorder. It's not my life. I'm not my anxiety. And when my anxiety comes up, I don't over-identify with it. I don't cling on to it. So if I have anxious thoughts, I realize that these are just anxious thoughts. These aren't my natural occurring thoughts. And allowing myself to realize that my anxiety isn't me, and that it's not my personality, it's not something that, you know, I have to identify with. It's just something I experience. And seeing it that way has really, really helped me. That is a bit about my journey. I'm so open to answering any questions you may have. I have a self-love course that teaches the concept of accepting yourself and being kind to yourself. Those two skills I talked about that have helped me with my mental health, I teach in my self-love course. My website is down below, and you can find my course on there. You need to be there for yourself because you need yourself more than you think.